Over 60,000 people in Uganda were diagnosed with diabetes in 2014, but the number has now alleged surged to over 1.6 million. This has raised concerns among public health officials. The Vice Chairperson of the Uganda Non-communicable Diseases Alliance and a physician at Mengo Hospital, Dr. William Lumu, emphasized the urgent need for the government to implement more regulations to combat the rise of NCDs, including diabetes, hypertension, cancer, and sickle cell disease. He warned Ugandans to prioritize their health, attributing the increase in non-communicable diseases primarily to poor nutrition, and urged the public to avoid drugs and alcohol to prevent various health issues.
You take a lot of salt, your kidneys are going to absorb lots, and they're going to absorb and retain water within your blood vessels. And once this occurs, the blood volume is going to increase. When the blood volume increases, your heart is going to use a bigger pressure to pump blood. And once that one happens, your pressure goes up. So that's the...
Dr. Lumu called on mothers to reduce portion sizes for their children, as rising obesity rates among youth are contributing to diabetes and high blood pressure. He also addressed the factors leading to increase of NCDs in children and highlighted the dangers of excessive salt intake.
Feeding our children on refined sugars. We don't pack right things for them. The juices in the supermarkets, the sausages. We are also having restaurants which are similar to McDonald's, what they sell. The biscuits of this world. You go and open people's fridges, what do you find? You find fridges are full of frankfurters, they're full of sausages, they're full of juices and the things that make people put on what? Put on weight. So those are some of the reasons why you are seeing an increment in the numbers of children with diabetes.
A senior medic, Dr. Christopher Kwizera, echoed these sentiments, urging Ugandans to be vigilant about their diets to better manage the risks associated with non-communicable diseases.
We don't allow each and everybody to start setting up a factory to manufacture food and sell them to people. They should regulate the foods that are on the market for the good of our country. Need regulation on excess consumption of alcohol. We already have laws and regulations on smoking. That one we are done, but we need enforcement.
Stephen Kayumba, Benon Mokwaya, UBC News.